Hello again everyone, Dr. Dan Bockmann here. Today I want to talk about why I don't care if you're in pain, or I don't care if any of my patients are in pain. And that sounds terrible, right? I mean, I'm supposed to care about it, at least feel bad for them. But what I mean when I say I don't care if you're in pain is that having pain or not having pain, that's a meaningless statement. So pain is not a binary thing, right? It's not a present or absent thing. There are degrees of pain. So for example, a bruise is painful, right? And a broken arm is painful as well. So they're both pain, but they mean very different things, and the correct response to them should be very different and should be appropriate. So for example, there's no need to worry about the bruise you have. I mean, it's a relatively minor injury. Yes, there's some pain. The pain is not severe and debilitating. A broken arm, on the other hand, deserves an immediate and appropriate response. It needs to be taken care of because it's a sign of a very serious injury that needs to be addressed. Now, when I say I don't care about whether a patient is hurting, it's often because we are naturally pain averse. Pain aversion is a good thing. I want it to hurt if I stick my hand in a fire so that I don't stick my hand in a fire. However, our tendency as humans is to hyper focus on the tiniest little pain or any pain that pops out of nowhere, no matter how severe it is, no matter even if there was no big injury that then resulted in the pain. Sometimes we get random pains, right? Even during a recovery, you're going to have pain. However, all I care about, it's not whether you have pain or not, I care about the amount of pain you have, the severity of it, and the trend that it's making over time. So for example, if your pain is moderate at worst, and you're not being forced to do things differently in your day because it's too painful to do those things normally, automatically that's a relatively mild injury and nothing to be super concerned about. We'll address it. But if, let's say, you started off with severe pain last week when we started your treatment, and this week the severity of the pain is coming down, and maybe last week it used to be constant and now it's just in the evenings. So that's two kinds of improvement. That's the severity of the pain coming down. That's the frequency of the pain coming down as well. And also duration of pain. So it's intensity, which is how much does it hurt, 0 to 10. If that's coming down, great. The frequency, if it used to be constant, now it's like here and there, that's a reduction in frequency, that's improvement. And also the duration, when it hurts. Does it hurt for an hour or two at first, and then a couple days later after treatment, it's only hurting for a couple of minutes at a time? Those are all examples of improvement in pain and a trend downward. As long as you see that pain trending downward, as your ability to do things, to do life is increasing, that is literally all that you need to worry about when it comes to pain. It's too easy to get hyper-focused. Doc, but I still feel it. And I say, well, how severe is it? Mild, moderate, or severe? Well, it's mild. I'll say, ignore that. And I try not to make them feel like I just literally don't care about them, but I try to press on patients, hey, the presence of some pain means literally nothing. Look at the trend. And if you see the trend heading your way, the trend is your friend. Relax and go with it and be more active in your life. So hopefully that's interesting or informative. If so, great. Leave it a like and a share. And if you have a question you'd like me to answer, leave that in the comment section below. And until next time, I will see you guys later.